So quickly trying to look at the next blood disorder. So this is what is known as what inherited coagulation disorders. So once you hear inherited, of course, so inherited, of course, once you hear inherited, you know that what it has to do with the patient actually got it from their parents, So for the inherited coagulation disorders, have it here. So basically list them, have an overview, talk about them one after the other, all of that. So these are disorders, they are genetic conditions that affect the body's ability to form clots normally, So these disorders result from mutations in genes that encode clotting factors, leading to what? You bleeding too much, or even when you don't need clots, the clots are actually forming, So types of inherited coagulation disorders are what? Hemophilia A and B. So this is caused by what? Deficiency in clotting factor VIII, that's hemophilia A. Then clotting factor IX, that's hemophilia B. So individuals with hemophilia experience prolonged bleeding after injuries or surgeries and may suffer spontaneous bleeding episodes, especially in joints and muscles. So von Willebrand disease is like the most common inherited bleeding disorder. So it's caused by what? Deficiency or dysfunction of von Willebrand factor, which helps what? Platelets to stick to blood vessels, and stabilize factor VIII. So alright, we have other ones like blood factor deficiencies. That's why I actually brought this coagulation pathway. So any of these blood factors here, if they are missing, of course you know that the coagulation pathway will not be complete. Then protein C and protein S deficiency. So this one said that these are inherited disorders that increase the risk of abnormal blood clots formation. So this is due to what? Defective regulation of clotting processes. So antithrombin 3 deficiency leads to an increased risk of developing blood clots. That's thrombophilia. This causes what? Antithrombin 3 because antithrombin 3 normally helps to control excess clot formation. Then clinical manifestation is mostly there's excess bleeding. Excess bleeding following minor injuries, spontaneous bleeding. They can bleed into the joint and muscles. There's increased clotting risk. So management and treatment is most of the times you identify the clotting factor that is missing, you always replace that. Then desmopressin helps to now boost von Willebrand factor, then factor VIII levels in milder von Willebrand factor, a disease. Anticoagulant, you use it to prevent excess clot formation. Gene therapy is a promising approach for hemophilia and other genetic clotting disorders. So guys, this is just it for the inherited coagulation factors. This one is just a summary of the most important ones that are likely to actually ask you in an exam. So this is just it for this.